Hello, Nebraska nurse practitioners. My name is Mark Harvey. I'm going to give a presentation at the upcoming Nebraska Nurse Practitioners Conference, October 4th through the 6th in Kearney. I hope to see you there. So this is a run through finding healthcare resources for the underserved and uninsured. My name is Mark Harvey. My wife, Monica Schmucker, is a nurse practitioner also, and she helped with putting together this presentation. She's kind of a genius in a lot of things, and that's my annoying dog, Sasha. Well, not annoying, cute as can be, but you know, whatever. Okay. So case study number 1, Maria. Maria is a 51-year-old obese Spanish-speaking woman. Today presents to the clinic for diabetes, dyslipidemia, toenail fungus, high blood pressure. Her last A1C was 11.2, which, as you know, is uncontrolled diabetes. She needs vaccination in order to see her grandson, who was born and is in the hospital. She does not have health insurance. She can't afford her Lantus or Humalog. She is taking lisinopril, terbinafine, amlodipine, metformin, and atorvastatin. One of the goals that I want to accomplish today is when you as a provider or a nurse sees a list of medications that a patient is on, I want dollar signs to go off in your head so you know how much these medications cost for that patient. Case study number 2 is Bob. Homeless Bob is a recovering alcoholic. He lost his toes because of frostbite, passed out under a bridge downtown. He did have heart issues, saw cardiology in the hospital, was started on some blood pressure pills from cardiology. He's not really interested in getting into the homeless shelter, but one of his excuses is that he needs a TB test before he can get in there. He's missing half of the foot on his right side and several toes on his left foot, and he has a lot of back pain and hip pain from walking funny. He's interested in quitting smoking. He did quit drinking alcohol a couple of years ago. The blood pressure pills that cardiology put him on cost over $100 for a month, and since that's about as much money as he makes in a year, he did not pick up those blood pressure pills. Pulmonology wants him to take Advair or Symbicort, but he does have a nebulizer, or he has access to a nebulizer because a friend has a nebulizer, and he goes to that friend's house when it's really, really cold out and stuff. He also has depression and anxiety. So we've got a lot of issues to cover with Bob. Just a little bit of background information. There's about 225, about 250,000 Nebraskans who do not have health insurance. And with the current state of affairs with the healthcare changes going on, that number could go up about 5 or 10 times. Who knows? Anyway, a lot of people don't have health insurance. We also have a lot of foreign-born residents of Nebraska, and a lot of those are Hispanic or Latino origin. Okay. I got this information from Nebraska Appleseed. Just a quick map of population centers in Nebraska. Now I'm here, so most of my information is local to the Grand Island area. Just so you know, there are a lot more resources in urban centers and a lot fewer resources out here in the middle of nowhere. When prescribing medications, this is a basic for you as a nurse, you as a nurse practitioner, you as a doctor, physician, any kind of provider. You need to ask everyone if they are able to pay for the medications that you are prescribing. If they can't pay for it, they're not going to take it, so why are you wasting your time and their time? Find out how much the medications cost. This may take a little bit of legwork for you. I timed it. It took me about 45 seconds to call USave and ask them how much lisinopril costs. Well, sometimes you're on hold for a little longer and it's annoying, but this is definitely a task that you can farm out to non-licensed personnel. There's no reason that you can't delegate this. Don't prescribe the medication if they're not going to be able to pick it up. Duh. I mean, does this take any kind of intelligence whatsoever? I mean, obviously it does, but not the kind of intelligence that you're taught in school, apparently. But if the patient is not going to be able to afford the medication, do not prescribe it. There's no point. Find a cheaper alternative. It's important as a primary care provider or as an ER nurse to coordinate with other providers and specialists regarding the cost of medication. So if a cardiologist comes into your ER and prescribes diltiazem CD, cardizem, the patient's not going to be able to afford that. So you need to actually have that conversation with the specialist. So how to find a free clinic. Here in Grand Island, we have Third City Community Clinic, where I worked for about 8 years full-time at the free clinic as a nurse practitioner. We have Central Health Center, which provides a wide variety of services with the sliding scale. There's People's City Mission in Lincoln. There's Healthcare Clinic in Kearney. There's the National Association of Free and Charitable Clinics. You can actually go and search for free clinics, although it does cost money for a clinic to join this organization. So, for example, Third City Clinic is not part of this organization because it costs too much money. Anyway, just FYI. So, FQHC is Federally Qualified Health Center. Federally Qualified Health Centers are not allowed to send patients to collections. They have to have real careful billing procedures. They have sliding scale, income-based fee schedules. So if your patient has some income, they can go to an FQHC, and their goal is to serve uninsured or low income and medically underserved people. And there's a bunch of FQHCs in Nebraska. You can go to their Facebook page, Health Center Association of Nebraska, and there's this great video that explains what a health center is. You can learn all about it. At a health center for many years at an FQHC. Here's the FQHCs that are in Nebraska. We finally got one in Grand Island. There's one way out there in Scottsbluff. Columbus has one, and there's quite a few in Omaha, one in Lincoln. And I went ahead and included in the handout contact information for each one of these community health centers or FQHCs. So if you're close to one of them, you can your patients to them. And it would be good for you to kind of learn a little bit more about them. They're wonderful places. And also, if you're a practitioner, you can get student loan repayment by working at an FQHC. So it might be worth your time to look into. So there's another type of clinic, the nonprofit clinic. Several hospitals in the state run nonprofit clinics. And a nonprofit clinic usually has a sliding fee scale or low cost for uninsured patients. So one example is the Mary Lanning has Community Health Center in Hastings, Nebraska, and if you meet their sliding scale income guidelines, you might only pay like $8 for a clinic visit, and they help with the cost of lab work. And I know that a lot of other hospitals do have things. I worked at a CHI nonprofit clinic for a number of years here actually in Doniphan, and so a lot of hospitals have this sort of thing. I've heard of several small town hospitals that do a sliding scale for people that don't have health insurance. And so they have I just put a little slide about the payment options. So they have payment plans, they have financial assistance. So if you can't pay, you just fill out financial assistance paperwork. A while back, several years, about the time that I first became a nurse practitioner, Walmart came out with the $4 list. This actually radically transformed medicine across the country. It was pretty cool because suddenly pharmacies had to start competing with Walmart. Walmart knew that if they could undercut everybody with these cheap medications that cost like a penny, they're still making a profit off of the medications, but they knew that if they could get people in their stores, they can make a ton of money at the pharmacy plus all the other money that you spend at Walmart. So Walmart this was a genius move on their part. But what it did is all of the other pharmacies had to start competing. And so most pharmacies now will have a low-cost generic medication list. And what you should do is print off that list every couple of months and read through it so you know what's currently on the list and what medications that you can get for your patients for low cost. You can just go to the Walmart website, click on the $4 list medications for whatever type of medical problem you're looking for, and you can find all that information right there. Darn handy. I wanted to talk about insulin because insulin is one of the hardest things for us to get for low-income patients. And if you remember the case study, Maria was on Lantus and Novolog. Well, in an emergency, we could get Maria old school insulin, the stuff that I hate, but works still. You can get Novolin N for 24 bucks and Novolin R for 24 bucks. Now, this is a cool app that shows medication prices. So I just wanted to kind of point out some of the cost differences. Humulin 7030 is 288 bucks, but Novolin 7030 is 24 bucks. Novolog 7030, the good stuff, is 538 bucks for a vial. So there's a big cost difference, so you need to know what you're prescribing. Lantus actually came down in price to $266 for a vial. Levemir is still $400. Humulin R is $100, whereas Novolin R was only $24. So that's good to know. We'll talk about how to get the expensive insulin in a little bit. Albuterol is cheap. However, albuterol inhalers are not cheap. Albuterol nebulizer solution we can get pretty darn cheap. You can get 25 vials for 10 bucks or less. This was on the Walmart $4 list for a while, but it's not anymore, I don't think. But so you can get albuterol, you can get Atrovent, or Duonebs even are pretty cheap. So remember Homeless Bob, he has access to a nebulizer machine. So if he needs a breathing treatment, we can get him the medication. I like to always save the nebulizer masks and pipes that we have in the clinic. I love to give those out to people because then that saves them some money. So I went ahead and did some searching. You can buy a nebulizer machine for less than the cost of an inhaler. You can buy, you can go on Amazon and buy a nebulizer for 35 bucks. And you could probably pick one up at Walmart for pretty cheap. So the cost of an inhaler, I went for the cheapest inhaler that I knew of, which is Ventolin albuterol inhaler. It's about 56 bucks, 60 bucks, somewhere in there. 70. So the inhalers are not cheap. Now, you know, I didn't talk about kids with asthma, but kids with asthma need an inhaler to have at school. And so, you know, then they can have a nebulizer machine at home if they need it, but they need to have something to take with them. So that's an obstacle to keep in mind. So I've been using this GoodRx app. It's pretty cool. You can put it on your phone. They also have an excellent website, and you can search for medications and then find the price for local pharmacies, find the cheapest price near you, whatever. It's not, you know, 100% accurate, but it can give you a good idea. For example, I wanted to give a patient Chantix this week, and so I just looked it up on GoodRx, and oh, it's $380. Okay. It's kind of expensive. Now, Homeless Bob, I call him that because I really love the guy. He's so awesome. I had to go drive around one time and find him to tell him about his appointment at the clinic, and had to drive under some bridges and stuff. I found him in a parking lot bumming cigarettes off a guy. He was pretty shocked to see his nurse practitioner pull up in the parking lot to tell him that he had an appointment at the clinic the next Monday. It was awesome. Anyway, I love Bob. So you could call the 1-800-QUIT-NOW phone number. At different times, depending on their grant cycles and stuff, they sometimes can get you Chantix for free. They can get nicotine replacement products for free. So we might be able to get Chantix for Bob through the Quit Now phone number. So Maria needs the good insulin. She needs Lantus and she needs Novolog or Levemir, a long-acting basal insulin and a short-acting mealtime insulin that is reliable and extremely expensive. So what we would do at the free clinic is go to needymeds.org. We would fill out an application, and we would be able to get expensive insulin for Maria and expensive inhalers for Bob, like Symbicort or Advair. You can just go to patient assistance programs right here, PAPs. So I always write this in my charts. I just abbreviate it, PAP, Patient Assistance Program, for expensive medications. And there's every drug company that has a branded drug out there has some sort of assistance program. So psychotropic medications, inhalers, insulins, specialty medications like Remicade, expensive stuff like that. There's patient assistance programs available. And so we have at the free clinic a full-time nurse who spends a lot of her day filling out patient assistance paperwork for these patient assistance programs through needymeds.com. Is a really great place because they centralize all of the different applications on that website. Community health workers. I love community health workers. If you can get a grant like we did and get a couple of community health workers in your clinic, they do amazing work. All of this stuff, finding medications and low-cost interventions for patients, a community health worker can do it. So you can just refer a patient to the community health worker, and they can help arrange transportation, for example. So I got a list from our community health worker about, she just kind of typed up a list of the things that she can do so that whenever there's a volunteer provider, she gives them the list. So when they encounter a barrier while talking with a patient, they can look at the list and say, oh, our community health worker can help you find clothing or housing or help you find a place where you can get signed up for health insurance or get referred for mental health services. Remember, Bob has depression and he needs to get referred to a clinic like Mid-Plains Clinic, where I now work, that sees low-income patients for a sliding scale fee, and we have a lot of funding to see patients who cannot afford mental health care. Other things they do, they can help you get a gym membership. There's scholarships available that they know of where they can get you a gym membership. They can help you with smoking cessation, get you enrolled in a diabetes class. They can connect you to legal services. I had to do this last week where a client really needed a lawyer. That was the main thing that they needed. And I was able to connect them to free legal care. Okay, so, and I learned from the community health worker about this 211 website, Nebraska 211 phone number. Basically, if you have any kind of need whatsoever, you can call this number and they will connect you to the services that can meet that need. I mean, whether it's rent, utility bills, you're facing mental health problems, substance abuse problems, you're worried about abuse, you need to get your kids into daycare, you just call 211 and they will connect you to the right services. Every Woman Matters is a wonderful program for cancer screening for women. They will pay for Pap tests and mammograms. If they diagnose breast cancer, they'll even pay for treatment. They'll do diabetes screening, heart disease screening. So there's a big form that you fill out and take it into your wellness visit with your primary care provider, your women's health nurse practitioner. For Every Woman Matters, you have to be 40 years old. You have to be a legal resident of Nebraska, so that kind of rules out some of our patients. You have to meet income eligibility guidelines, which is, pretty high, so most people will qualify. There's Nebraska colon cancer screening program. So after they men and women can get a colonoscopy, fecal occult blood testing, so you can get colon cancer screening done. Immunizations. So Maria needs a Tdap. She hasn't had her pertussis booster. And Bob needs a tuberculosis test. So you can go to the health department. Your local health department probably has an immunization program. And so Central District Health Department here in Grand Island has a wonderful immunization clinic where you can get low-cost shots. And there's also the Nebraska Vaccines for Children program. So your primary care provider can get a lot of vaccinations covered. Vaccines for children. So I kind of just put some of this information in the handouts. There's diabetes programs available. Health department, for example, they're doing diabetes prevention classes, which I've had several patients go through this and they really liked it. They learned a lot about nutrition. They were just in a group of people like themselves where they actually started exercising together and just learned a lot about preventing diabetes. For mental health care, there are regions. The state of Nebraska is divided into regions. I'm in Region 3. So I work at Mid-Plains Center, which is, if you have no insurance, then we fill out paperwork to have Region 3 funding to help cover the cost of your visit. It doesn't cover your medication costs, which is why we have to refer back to the Walmart $4 list sometimes, or the patient assistance programs through the drug companies. but it does pay for you to see a counselor and to see a medication provider. So the region mental health system, very useful for a lot of our uninsured clients. In some ways, I think that my uninsured patients get better care than if they had insurance, because they couldn't come see me if they had health insurance. That's not true anymore, but it was true when I worked at the free clinic. But here's the regions of Nebraska. Okay, so case study recap. Maria, we were able to fill out patient assistance program paperwork to get her expensive insulin. All of the other medications that she had was on the $4 list the last I checked. Now, amlodipine kind of goes up and down in price. So does atorvastatin. For a while there, it was $50, so she couldn't afford it. But then it came back down to less than $10. So, but there are expensive statins, name brand statins, that we can get through patient assistance programs. So we might be able to apply for that for some of her medications. For Bob, we were able to get him Symbicort through patient assistance program. We got him Chantix through the Nebraska Quit line. We got him referred for mental health counseling. Now, the most hilarious story about Bob is I was working with an awesome nurse practitioner, Nadia McCann, while she was in school. Bob came in. You know, I assumed there was nothing we could do about his toes, but Nadia said, hey, my cousin could get him some toes. Her cousin is an orthotics and prosthetics guy, and he does missions trips, and he said, yeah, I'll do a mission trip to Grand Island. So he drove to Grand Island and made Bob some toes. So we actually got Bob prosthetic toes to go in his boots so that he could walk around without having a lot of pain. That was a story with Bob where I had to actually, since he didn't have a phone, I had to drive around downtown under the bridges and stuff looking for him to tell him that he had an appointment at the clinic to get new toes. And he was, you know, he started crying. It was pretty touching. But we got him toes, and it was a wonderful end to that story. He was doing much better. Okay, I'm excited to see you at Nebraska Nurse Practitioner Conference. We're in combination with the Nebraska Nurses Association this year in Kearney, Nebraska. It's going to be an awesome convention. I'm super excited. There's going to be a 5K race, and yeah, so thanks for listening. We'll see you there.